Okay, so I've read the chart, and before entering the room, I've washed my hands. Knock, knock, knock. Hey, good morning. How are you doing? Good. My name's Shakora. I'll be your student physical therapist assistant today. Before we get started, can I just have you confirm the spelling of your last name and then also your date of birth?
Carlyle, 5/21/92.
Perfect. Just want to make sure that I had the right patient. So I read your chart and I saw that you recently had your right hip replaced. And they did an anterior approach. And there's a couple of precautions with that, but I'll get to that and I'll talk to you about it later. So that way we avoid messing up any surgical incisions or anything, okay? So right now, are you having any pain in that hip?
Not much. It's about 2 or 3, I'd say.
Okay, perfect. Alrighty. And then just tell me like a little bit about your goals. I saw that you were an avid tennis player, so just tell me some things that you're looking to accomplish with therapy.
Just be more mobile on the court too.
Okay.
So I don't want to be stiff. I don't want any stiffness to set in. I still want to maintain my range of motion, I guess.
Okay, gotcha. Alrighty, and I'm gonna go ahead and take the patient's vitals. I'll get her heart rate. Okay, I got the heart rate. Alright, so today we're just gonna do a couple of exercises to kind of strengthen the muscles in your right leg. And then also I saw that you're having a little bit of hamstring tightness in that left leg, so I'll give you a stretch that we can do with that as well, okay?
Okay.
Alrighty. So before we start, I'm gonna kind of talk to you a little bit about our precautions that we have. So because they did the interior approach, there's some things that we wanna avoid doing. And one of them is flexion of the hip. And that looks like either, like if you're sitting, bending down to like tie your shoes or lifting your leg up this way. So we want to avoid flexion past 90 degrees. So if you think of 90 degrees, it's like a right angle. So we don't wanna make the angle smaller. Okay. Another one is external rotation. So if you think about it, if you're sitting or you're standing and you turn your toe out to the side, out to the right, that right leg, we want to avoid doing that as well. And then also we want to avoid hip extension. So what that looks like is bringing that affected leg back behind you this way. And then also we want to avoid hip abduction, abduction. So what that is bringing that foot away from your body, so kicking it out to the side. And there's also a combined motion that we don't want to do of flexion. Sorry, I'll do it this way. So flexion, external rotation, and then adduction. So this funky little position, we kind of want to avoid that because that's really going to put a lot of pressure on that surgical site, and we can risk popping that hip back out of place. Okay. So I'm gonna have you to come up in the sitting position, but since we do have those hip precautions, I first want you to come up on your elbows. There you go. Yep, and then you can slowly push yourself up onto your hands. There you go. Just wanna make sure that we're not crossing those 90 degrees, which we're not. And then I'll have you go ahead and scoot forward. Perfect. So the first exercise that we're gonna do is a long guard quad. So what that looks like is you're gonna be sitting up, and then we're just gonna kick that foot straight out and then bring it right back down, okay? So
show me the stretch.
I'm gonna do that afterwards, so that way when I get you in the laying position, I'll have you laying back down, okay? So I'm just gonna hold my hand up here and have you go ahead and kick out for me with that right foot. And we're gonna go to 10.
2.
Good. Can you count for me?
3. 4. 5. 6. 7. 8. 9.
Last one. Perfect. And how's that feel? That's okay. Didn't cause too much pain or irritation in that hip. And if you feel any like extreme pain or discomfort at any point, just let me know and we'll either modify or stop if we need to, okay? Alrighty, so the next one that we're gonna do, I'm gonna have you stand up, but maintaining those hip precautions, one thing that we need to do is kick that foot out in front of us, so that way we can push up with our hands and stand up. So when we do it like that, then we're keeping that ankle nice and open, and we're not gonna flex past 90.
Okay.
So we're gonna scoot to the edge, there you go. Perfect. Alrighty, and I see that you're nice and stable, but just to be sure, I'm gonna go ahead and put my gait belt around you. Lift your hands. There we go. Okay, so the next one that we're gonna do, and I know that your weight bearing is tolerated, so you can put as much weight as you can tolerate without pain on that foot. We're just gonna do heel raises, so coming up onto our toes. Okay, and we're gonna do one set of 10.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect. And no pain with that one either?
A little soreness.
A little. Okay, and that's fine. So the next one that we're gonna do is gonna be a little bit tougher. It's gonna be a mini squat. So instead of us coming, all the way down like that, we're just gonna have our feet about hip width apart, and then just a mini squat, not even going parallel. Okay, and we're gonna do 10 of those. There you go.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Perfect. Alrighty. And I also saw in your chart that you do have asthma, and I'm seeing now that you're breathing a little bit heavily. So I do want to do a breathing technique, so that way it can kind of help you out with that, help you catch your breath, and it'll just feel a lot better for you. So what we're gonna do is called pursed lip breathing. So what that is you're gonna, with your mouth closed, inhale through your nose, and then you're gonna exhale through your mouth, but almost form your lips like you're gonna whistle. Okay, so it'll be like, you do 5 of those. Last one. Perfect. Kind of feel like it opens up your airway just a little bit more. Awesome. Okay, so I'm gonna have you take a seat now. We'll go ahead and take a step back. And before we sit down, again, you're gonna have to kick that leg out in front. There you go, reach back with your hands and have a seat. Awesome. Okay, before you scoot back, we're gonna do one more exercise. So I have my TheraBand here, and we're gonna just do a hamstring curl. So I'm just gonna put this back behind your leg. You can kick out towards me, so go ahead and straighten this leg out. Okay, and then you're just gonna pull back against the resistance band, okay? So bending at the knee, go ahead. Give it a little bit more slack, okay? Good. And we're gonna go to 10. Can you count for me?
3, 4, 5, 6, 7, 8, 9, 10.
Perfect. Go ahead and relax. Awesome. All right. And then I'll have you go ahead and scoot back. You can lay down, and I'll take you through that hamstring stretch, okay? Awesome. Okay, so we're going to leave this leg extended just like it is. This one, we're going to bend up at the knee. Okay, I'm going to have you reach behind your leg with both of your hands. Okay, and we're just going to pull towards you. There you go. You should feel a nice long stretch right back in here. Okay, 2, 3. Good. Relax. Okay, I'm going to hold it for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. Relax. How'd that feel?
Yes.
Okay, we'll relax and then we'll do it one more set of 10 seconds, okay? Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Good, relax. And this one you can do from anywhere between like 30 seconds and a minute, just as long as it's not uncomfortable for you, okay? Alrighty, and I'm just gonna take your vitals one more time before I leave. Okay, I got your heart rate. And I've got your respiration rate, looking good. And I'll take my gait belt back from you. I don't think you wanna keep that.
It's nice stuff.
Alrighty, do you have any questions for me?
Oh no, you did a good job explaining everything, thank you.
You're welcome. And again, just remember, you know, just the flexion, we wanna avoid that. So if you're thinking of putting on your shoes, have someone help you for now. Don't bend down and do that. Don't cross at the ankles or cross your knees, you know, when you're sitting. And then don't turn that toe out to the side, okay? Alrighty, well, thank you so much for working with me, and I'll see you tomorrow, okay?